We're here with James Reilly. He's the Minister for Health of the Republic of Ireland. I had the privilege to meet him actually briefly in one of my trips to Ireland. We're really happy to have him here today. Now, this is a day, as everybody knows, that it's a celebration of a kind of Irish tradition and what I might call the old Ireland. That's all the cultural things and all the musical things that we have that we enjoy with Irish culture. But there's this whole other part of Ireland that I think Mr. Reilly very well represents, and that's what I would call the New Ireland. It's about a lot of things, including cutting-edge technology and also medical innovation in particular. And that's what we also have in common. Not just our cultural ties or ties of ancestry, but also we like to consider ourselves one of the capitals in the United States of medical technology and innovation. And not everybody knows how close our ties are with Ireland and their own health industry and everything that they've been able to do. And so I'll turn it over to the minister for a few words. But we had a great day today so far here today, touring this facility and all the progress that we've made. We're very proud, of course, of the Global Center for Health Innovation. We have 80% occupancy now, roughly, in terms of tenants. This is going to be a success, and this is going to be kind of our flagship of our medical industry here. So we wanted to make sure that the minister had an opportunity to see not just what we've done here, but how it can integrate into what the great work that they're doing in Ireland as well. Minister?
Thank you very much, Ed. And I'd just like to thank the county executive for affording me the time out of his busy schedule to come and see this, which is obviously, breaking new ground, something that we're very interested in Ireland. We're reforming our health service, and this is an area we're particularly interested in. And I think, as Ed has said, it's great for me to be here as an Irish minister on St. Patrick's Day. We're really delighted with the real strength of the link between Cleveland and Ireland, and the huge amount of people from Ireland who are out here in Cleveland. And I know that St. Patrick's Day Parade here is such a huge event. But I think it's very important, as Ed has said, that Ireland is recovering. We're creating more jobs now than we're losing. Our bond yield has fallen from 15% to under 3% when we borrow money now. So we're back as players in the market. We're really open for business, and we're looking to a new future. And this is a new future here, and it's the sort of new future that we're interested in. So I think this is a real case of where old bonds and tremendous connections can lead to new opportunities for the people of Cleveland and for the people of Ireland. And I'm really thrilled to be here today, and I want to thank you again for your time.
Sure. Any questions?
Are there particular linkages between Irish health companies and Cleveland that you're hoping to sort of build here? Any kind of pipeline you're trying to build?
There is indeed. I mean, we were accompanied here today by Frank Dolphin of Reilly who are doing work with the Cleveland Clinic. But many of the problems that you face here in America, we face in Ireland, and it's certainly around the whole lack of cohesion around the information we gather in healthcare, which can lead not just to better outcomes for patients and less pain for the taxpayer, but in fact jobs. I mean, health is often seen as a draw on a nation's resources, whereas in fact you can't have a healthy economy unless you've got a healthy workforce. But more so with these sort of global innovation approaches, you can create huge amounts of high value jobs and high net worth for your people, as well as improving, of course, the outcomes for patients, which is what every health service should be about.
Yeah, there's established links, and not everybody knows about it, between Ireland and Cleveland area health institutions. And I would just note, as one example, the Cleveland Clinic. They've had quite a long relationship with a lot of their surgeons coming out of Ireland, and also now, as it was just mentioned, the company that has an arrangement with some of the nursing care as well. And so that's something that we're looking to build on.
So I mean, the real exciting opportunities that lie ahead for us are not just in technology and how we use it and how we keep people more independent and at home longer, because I'm sure it's no different in America than it is in Ireland. I've never met anyone who wanted to go into long-term care before they really needed to be there. But it's also expanding the roles of the clinicians that we have at the moment. So we have, specialists sometimes doing work that those with less specialist education could be doing. We have doctors doing work that nurses could be doing, nurses doing work that healthcare assistants and allied healthcare professionals could be doing. And technology will allow support all that and make it more cost effective for the health service, better outcomes for the citizen, as I've already said, and also a greater sense of value and enjoyment of work for all those other healthcare professionals who work in the system, who were not, shall we say, exploiting their abilities to the full.